Hello everyone and Namaste. Welcome back to our channel PhysioHealer. I am Dr. Nisha Kanabar from PhysioHealer and today we are going to discuss cervical PIVD, which is called as cervical prolapsed intervertebral disc. Its symptoms, some self-examination tips, and I am going to share some tips to manage its symptoms. But before we begin, let's understand what is cervical PIVD. Cervical PIVD refers to the condition where one or more intervertebral discs in the neck region become damaged or herniated. This can result in pain, tingling, numbness and weakness in the neck, shoulder, arm and hand. I'll guide you through a self-examination for cervical PIVD that you can perform at home. It's important to note that this examination is not a substitute for professional medical advice, but it can help you assess your symptoms. Let's get started. Step 1 of examination is assessing neck pain. So here you are supposed to begin by assessing your neck pain. To do that, gently move your neck in different directions, such as bending forward, upwards, sideways tilting, and rotation sideways. Pay attention to any pain or discomfort you experience during these movements. Note the severity and location of the pain. This information will be helpful for your healthcare provider. Step 2 of this examination is checking range of motion. Next, let's check your range of motion. Slowly turn your head to the left and right. Left side and then right side, as far as you can comfortably go. Take note of any limitations or pain during these movements. Then tilt your head sideways towards each shoulder like this, left and right. Again, noticing any discomfort or restrictions. So next we are going to assess nerve related symptoms. 3 is assessing nerve related symptoms. Now let's assess any nerve-related symptoms that can be experienced by you if you have cervical PIVD. Pay attention to any tingling, numbness or weakness in your neck, shoulder, arm or hand region. Try to identify these symptoms which are present on one side or both the sides of your body. Step 4 is evaluating pain triggers. Lastly, let's evaluate the activities or positions that may trigger your or worsen your pain. Make a mental note of any specific movements, posture or activities that tend to aggravate your symptoms. For example, some of you may feel aggravation of pain symptoms while bending forward. Some of you may feel the aggravation of the symptoms while rotating your head. This information will help you make adjustments and avoid those triggers as much as possible. Step 5 is pain or symptoms which aggravates while coughing or sneezing. This can cause inflammation and pain in the surrounding tissues, and it may also cause numbness, tingling and muscle weakness. The pain from a herniated disc may worsen whenever you cough or sneeze. It's time for some tips. Maintaining a proper posture and positions can help alleviate symptoms and reduce strain on the cervical spine for individuals with cervical PIVD. So here are some recommendations. You have to look at your sitting posture. Sit with your back straight and aligned against the backrest of the chair. Keep your shoulders relaxed and avoid slouching or hunching forward like this while doing any work for a prolonged duration of time. Use a chair with good lumbar support and consider using a cushion to support the neutral curve of your lower back. Ensure that your feet are planted flat on the floor or supported by the footrest if needed. Next is standing posture. Whenever you stand, stand tall with your head aligned with your spine. Keep your shoulders relaxed and avoid rounding them forward. Distribute your weight evenly on both feet. Engage your core muscles to support your posture. With this condition, with severe pain, whenever you sleep, we have some sleeping positions. Sleep on a supportive mattress and pillow that helps maintain the neutral alignment of your neck and spine. For this, do not use too soft pillows. Back sleeping during this time, place a pillow under your knees to relieve pressure on the lower back. Use a cervical pillow or roll small towel to support the natural curve of your neck. During side sleeping position, use a pillow that is thick enough to keep your neck aligned with your spine. Means the normal thickness should be the gap between your neck and shoulder while sleeping in sideline position. Place a pillow between your knees to maintain the proper spinal alignment. While lifting or carrying anything, use proper lifting techniques to avoid straining your neck and back. Bend your knees, keep your back straight and lift with your legs. When carrying objects, distribute the weight evenly and avoid carrying heavy loads with just one hand. Very important point, taking breaks. If you have a sedentary job or perform tasks that require prolonged neck or upper body positions, take regular breaks to move and stretch. Change your positions frequently and perform gentle neck stretches or range of motion exercises during break. Do remember, these recommendations are general guidelines and it's important to consult with a healthcare professional or a qualified physiotherapist for personalized advice based on the specific condition. They can assess your posture, provide specific recommendations and help develop an individualized plan to manage cervical PIVD. And that concludes our discussion on posture and positions for cervical PIVD. Remember, maintaining proper posture and positions which can help alleviate symptoms and reduce strain on your cervical spine. By following these recommendations, you can support your healing process and promote a healthier spine. Thank you for watching today's video, and if you found this video helpful, please consider giving it a thumbs up, sharing it with others may benefit, and subscribing to our channel for more informative content. Take care and we will see you in the next video.